My name is Dr. Tiffany Poole. I have been a chiropractor since 2010. I graduated from Texas Chiropractic College. Before that, I went to the University of Texas at Austin. That's where I got a degree in neurobiology. In 2020, Dr. Gandhi and I started talking and seeing how we could work together to help with different mutual patients that we have that could maybe really benefit from airway dentistry, or how they could benefit through pediatric chiropractic or even adult chiropractic.
What we know is that everything in the body is attached to each other. So the connective tissue that makes up our tongue tie or our lingual frenulum is attached to the connective tissue that covers all of our muscles down to the tip of our toe. When we work with our pediatric providers, we're really looking to them to help release that baby's body tension and tension inside the mouth to help make them as mobile and as even as possible.
Most of the patients come in and they have some sort of feeding issue. That's usually where they'll either talk to their pediatricians or they'll seek out lactation support, and that's how that usually occurs, where they get referred to either a pediatric dentist or a pediatric chiropractor. Some of the benefits of an infant seeing a pediatric chiropractor are help with not only structural alignments. We often see babies that come in with rotational preferences. Sometimes they've got head tilts, sometimes they have issues latching, sometimes they have colic-like symptoms. That can often look like they're inconsolable, they're crying for hours, they have very poor sleep, so they're maybe only taking 30, 45-minute naps. They're not able to nurse or transfer milk efficiently from a breast or bottle. So those are a lot of things that we see with infants coming in to the practice.
Chiropractic care is not cracking and popping your baby. It is a very gentle, almost looks like a massage. When we use them in the function first model for a baby that needs a release, we are sending them to the pediatric chiropractor before to help loosen up as much as possible inside and outside of the mouth, and then afterwards to help realign everything now that everything is looser in the body.
So with my own kiddos, I saw a lot of feeding issues. We had to switch from breastfeeding to giving formula to giving bottles to trying to breastfeed and doing the triple feeds, and so that was really tiring. And I always remember thinking I really wish that I had had somebody communicate these things to me so that I could go down different avenues and paths and not just kind of, okay, here's a bottle, here's formula.